When you have not given us water, which we need for survival, when you are not giving road, despite promises, we have not seen anything. Today, suddenly we have ministers, district officials coming to our doorstep and saying, get vaccinated. And that will, we want to save your life. These promises and this message sounds very hollow. So I'm a medical doctor, specialized in community medicine. I have been working as a community health practitioner and researcher, working in Chamarajanagar district since 2012.
I work at the Institute of Public Health, Bangalore. We've been doing research with tribal communities in the district. One of the events in Chamarajanagar which was very tragic was that several people died on a single day. Suggested that it is due to breakdown in the oxygen supply chain. So both of us at the time being trained in public health and living in the district, we felt it is imperative to sort of immediately join hands with the district administration. From many other organizations also joined us, and we were able to immediately get deployed into the district and taluka hospitals. The idea is, how do we work with the government health system so that it is more responsive to the needs of the community.
We started getting reports in the media about how in certain tribal hamlets, when ambulances went, when health workers went, people were running away into the forest. And this didn't sound very right to us because we have been working with the community for a very long time. A lot of the rules and guidelines which the administration was trying to implement for the better of the entire district were being implemented in a way without conversation in even remote tribal hamlets. We were in a hamlet called Jirge Gadde in Hanur Taluk, where we witnessed actually a hostile situation that was just getting worse and worse. Tensions were getting worse, where even the administration had come, local administrators were there, health workers, everyone, but no one was able to diffuse the situation. And it was essentially a family being told that they had to go for institutional quarantine because that was the policy at that point of time. If the quarantine center was nearby and if it was done in partnership with the community, then the people had agreed to cooperate. And that is how we established the state's first Adivasi COVID Seva Kendra in a residential school which was right next to the hamlet, but it was managed and supervised by members of the Soliga Abhivruddhi Sangha at the taluk level, at the district level also. And by the time the second wave was over, almost 30 Soliga men, women and children had voluntarily gone and gotten admitted there and had come out with successful cure.
When you see around here in Chamarajanagar and many other rural areas, what you find is that the only way of engaging is by sitting and having a conversation in small groups. The game changer in this was Basavaraju and team at the Pusumale Kalatanda's Corona Mari street play sequence. And he really wrote it originally, he scripted it, took feedback from multiple people, incorporated it. And he's just a local folk artist. I think the only right thing we did there is we took the problem to him. Instead of us using sophisticated knowledge, we said, "Yen madodu? How do we communicate?" And he had the answer.
Today, the vaccination in nearly 120 hamlets has crossed more than 80%. In fact, more than 60-70 are 100% covered.
Change must come through change makers that are all around us, be it the Panchayat Development Officer, be it the ANM, the ASHA, the Anganwadi worker, teacher. All of these are change makers, and I think we must empower them to be able to make the change we need.